start running again or squatting again or, playing golf or tennis or something, and you're still worried and have all these traits, but it's almost like you're building a case to yourself for resiliency. So that's what I mean about reconciling biomechanics. It's like we have a biomechanical intervention here, but really maybe the target is fear, worry, anxiety, depression, catastrophizing, right? It's just they do it all together. And sure, maybe you get stronger and stiffer and good stuff like that.
I like that phrase, like you're building a case. It's like if you present to your knee credible evidence that it is still healthy enough to run, to hike, to swim, to bike, to lift weights, what happens then? If you do that, you present that case, what changes? Why does the pain improve?
Yeah, don't ask me. So one theory, goes right back to like when you take in that Gatorade, you swish it around, spit it out, and your brain predicted the response there. And that's why you had the insulin or the glucagon or the sugar change. So the brain was predicted, it anticipated, it did something before. That would be one of the ideas where somehow the brain or the nervous system just responds differently to whatever is going on at the knee. And you could have I think you can actually have specific tissue chemical changes going on there. Because the way the nervous system works, it's not just bottom up, right? It's not just sending information from the knee. It like nerves can have trophic or have can inject chemicals, excrete chemicals the other direction as well. Right. It's so interesting. Like neurogenic inflammation, when you have a cut, you'll see redness around it when you're healing. That's what the nerves did. There's other things I'm not a neuroimmunologist, but there's things that are excreted down there, make you more sensitive stuff. Well, that's my favorite, like substance P. That's one of them. They didn't even try to come up with a name. They just said, "Oh, it's substance P. How's that any better than stuff?"
So, I mean, what would your advice to a runner be if they have been told they have? And I presume you get this in the clinic. I mean, I don't know if you want to use a specific example. Specifical? That's not a word.
Yeah.
Specific example. How do you advise runners? What do they need to think about if they've been told they have knee arthritis and maybe they've even been advised to stop running? Yeah. What are some of the things you need to think about?
I ask them what they think. Like how have you felt? And it's what's so interesting is like, when do you feel better? When do you feel worse? And so often it's like, oh, I feel better when I'm running. And I'm like, okay, well then we gotta run, man. Or I'd be like, I run, but I'm a bit sore. And what do you think about that? No, I'm just sore. I'm 56. Hurts when I run a bit. How are you the next day? Back to normal. I'm like, okay, let's trust that. Right? We can't always trust the body, but we can a little bit. Right?
Well, I think I know what they think. They worry, and I would too, that in the long run it's going to get worse if they keep doing it.
Yeah. So I would. This is where you have to talk about the research. I say, well, in the long run, it doesn't seem to make it worse. And then I would also say, what do you think is going to happen? And I would say more to women, and just jokingly, I'm like, okay, so you're worried about getting a hip replacement or something like that. And I said, well, what would you rather have, a hip replacement or be dead? And they'd be like, what? And I said, well, you get a hip replacement. But the other thing that happens, running or hopping and skipping, these things can kind of build your running doesn't build your bone density as much. I thought it did 15 years ago. I would be like, well, running would build your bone density. And if you don't run and you have low bone density, what can happen to you? Well, I can break my hip. And then what can happen? You can die, right? Like some people die of hip fractures. So I thought I could catastrophize the other direction. But that's what I mean.
Scare them into running.
Exactly. Scare them into running. You got to look at it the other way. Like, what are the costs of you not running?
Yeah.
Right. That's important as well. Like, oh, okay. So there's this tiny remote chance that it increases your risk of getting a knee or hip replacement. That's really suspect. If you feel good, it's okay.
Well, I think that's the thing, is that I only in recent years have come across the research that shows, especially recreational running, it might even have a protective effect against
Yeah.
symptomatic, like painful arthritis in the knee, as far as I'm aware.
Yeah.
And I didn't know that, So if a runner doesn't know that, then they've got to be able to know that so they can weigh that up against, okay, if I quit running, what's the likelihood I'll do something else? And it's usually something easier, like walking, right? And then you're like, well, what if then you go on to develop other health problems that you could have mitigated with running, like heart disease, diabetes, obesity, like these other things that have really, like you said, like you might die from these things.
Yeah.
So you're weighing up a potentially not even a higher chance of getting a knee replacement against an almost certainly higher chance of having a serious health consequence. And that's a much, much different question.
There's that. And I don't know this research well because it's out of my sphere, but you look at like what increases your risk for mortality. And I know in men, it's often like loneliness and a sense of social isolation. And what's so great about running, especially in Canada with the running room, right? You got like people meeting to run every Sunday morning at that store. Like for a lot of runners, it's who they are. It's their social network. I would never take that away from someone. Like, we gotta keep people doing the things that they love. That's huge. Yeah. There's less of a social network and trampolining. That's the problem. That's what I miss about running. It's just me and a bunch of 20 somethings. Right?
But you used to run, right?
And I did. I just I wasn't competing anymore. I would always compete against myself because I was traveling so much. So it was hard. You know what I mean? I wanted to break 20 minutes in the 5K. I always was driven by numbers.
So it wasn't because of knee arthritis. You didn't quit because you were worried about your knees.
No. I wanted to qualify for Boston, so I gave it a good year or a year and a half, and couldn't do it.
So what's your PR for the marathon?
It's 3:28.
What did you need?
Probably that year, like 3:14. It was 3:15, but it probably needed 3:13. I had done the Yasso. What was so sad, I did the Yasso 800s with an average of 3:08. I'm probably the worst, like way off. You know that predictive test where it's 10
I do. 800? But could you explain just for the listeners it? Because I've done it before. It's horrendous.
I loved it. And I did it like 2 months before. It's Bart Yasso writes for Runner's World, and he would say like a predictive test for your marathon is you do 10 800s. Right. And then I rested 2 minutes in between the 800s, but some would say you just rest the same time. So my average for those 800s was 3 minutes and 7 seconds with huge variability. And so what he says, you take your average and you turn the minutes into the hours and turns the seconds into the minutes. So my prediction would have been to run a marathon at 3:07. And I knew that was off, but I thought, oh, that's okay. I got a bit of a buffer. But I ran 3:28. Like I had a positive split of like a 1:37, 1:36 half, and then a 1:55 or something. I don't know, 1:52. It was bad.
And then you got into gymnastics.
Yeah.
And how's that going?
That's hard too. Like that's the thing. Like you're sore a lot. Like because I was trying to get really good at round up, back handspring, back tucks, and like to get better, you have to overtrain. And there's a moral here. Like so I chose to be in pain because I was trying to train 4 to 5 days a week really hard because that's the only way I could increase my skill. And I did that for like a year, and I still do it, but now I do it more I do more trampoline, I do softer stuff. So I still train 2 to 3 days a week doing it. Not so much with the COVID, but so you get, that's the thing. So like I didn't ruin myself. I'm not in pain because I trained in pain for 6 months. You can recover from stuff like that. You just have to have a choice. Like it didn't mess me up. I'm probably fitter for it and healthier for it.